You see one? How bad is it?
It's all over.
You have concussion, retrograde amnesia.
I love how the opening scene is in a strip club. Can you imagine telling your mom, you're like, Mom, I'm in a medical drama as an actress. And they're like, what are you doing in the drama? Are you a nurse or one of the doctors? And he says, no, I'm the stripper. Oh, man. But retrograde amnesia is basically where you forget things that happened previously. That is in contrast to anterograde amnesia, where you can't form new memories, which is more associated with things like dementia, while retrograde amnesia is more like head trauma.
Someone is going to die.
Kenny!
Not you. I saw something, a symptom. Someone is going to die unless I find them.
I wonder what symptom that was. It literally just clipped you, a very short black and white clip. Looked like there was some foaming at the side of the mouth. At this point, you know, things that cause foaming are things like maybe seizure can do it, but it looked like they were conscious. Didn't look like there was any limb jerking, so it doesn't quite fit. And then, you know, things like rabies as well, which is really rare. Most people think you can only get rabies from rabid dogs, but lots of rabid animals like cats or bats or any animal that ends with ats, it seems, although I can't. Are there any other animals that end with ats? Huh? Let me know in the comments section below if you can think of any other animal. But it's very important if you get bitten by a rabid animal that you get treated as soon as possible with the rabies vaccine, and then if you do end up developing symptoms, you can get the rabies antibodies as well, because it can be a fatal condition if you get infected. Basically the virus climbs up your nerves and stops them working, and you kind of need your nerves to live, so don't take a chance.
I saw somebody dying.
You saw 30 people flying into glass and metal.
I saw a symptom before the crash.
You're concussed. You don't know what you saw, and you don't know when you saw it. A week ago, you noticed a symptom in a soap star.
Who would notice symptoms in soap stars? I can't think of anyone. Well, maybe it was a seizure and that was the symptom he saw, and that led to the driver actually crashing. I mean, it would make sense. That's why, you know, if someone's had a seizure, we basically say that they can't drive a normal vehicle for 6 years. If it's like a category 2 vehicle where you have the potential for more damage and injury, like a bus or a full trailer, then the ban is actually more like 5 years. And then if there's a second seizure, there is an even higher likelihood that it will happen again. So if it's a normal car, it's like 12 months. And then a category 2 vehicle, you can't drive for 10 years. So for truck drivers, having seizures, it can be catastrophic, lead to career changes being needed as well. It's a shame. So it's just for the benefit of everyone else on the roads.
If it's not a coincidence.
You mean like the hand of God reaching down and screwing with you?
That, or the symptom caused the crash.
Yeah, so, I mean, the symptom could cause a crash. We did mention that before. You got to move faster if you're going to keep up with me. Although I will let you off. You have got a concussion, so not going to compete diagnostically with a TV program. That is, yeah, who would do such a thing?
Right here. Purpura on Ralph Clandon's neck. Indicative of leukemia. Caused a bleed in the brain, hence the accident.
Indicative of wearing a seatbelt. It's just a bruise.
Yeah, so purpura is essentially when your skin has small vessels that start leaking, and it can be for various reasons. Leukemia could be one of them. Essentially, the blood and blood products are produced in the bone marrow, which is like a factory, and leukemia starts to get rid of that factory, break it down, and that leads to different types of things in your blood, like your red cells, which carry your oxygen, your white cells, which fight infection, and your platelets, which stop you from bleeding, being all reduced, and so you end up being susceptible to the things that they help with, and that's why you get this kind of bruising-like appearance on the skin called purpura when you have low platelets. But there are some other causes, things like vasculitis, which also lead to those signs. So if you do have odd bruising in different places, then you need to get that checked out. And sometimes we never even find a cause for it, but it's always worth being safe rather than sorry.
I need him to stay.
I just have a stiff neck from the crash.
This man has meningitis. You need to quarantine the whole ER.
I love how just a small stiff neck after a crash, and House is like, no, stop anyone from leaving. But I think it's obviously just so that he can keep people there and investigate rather than because they need isolation. Meningitis, we get cases in A&E all the time. You don't need strict isolation for it, but if close contacts are unwell as well, or particularly vulnerable, then they get antibiotics to stop them developing bacterial meningitis, which is the more dangerous one. There is also viral meningitis, which is more common, and essentially you can't differentiate between the two without doing a test called a lumbar puncture, which is where you put a small needle in the spine and you get some clear fluid out, and then you basically test it. I remember having to do one of those in a baby, and the space that we had to get into was so small, but thankfully managed to do it. And of course, for procedures like that, we make sure the mum is not in the room, because it can be traumatic seeing your baby get a needle there, but the chances of long-term complications or any injury from that are small, but you need to make sure that you fully know the risks before you agree to any procedure. The other thing is meningitis. It can be quite fatal. Some signs of it are basically fever, neck stiffness, a sensitivity to light, and the reason why it's dangerous is it causes infection, not just around the brain, but also through the whole body. And that leads to people becoming very, very unwell. It also causes a rash when it's done by the classic bacteria, which is Neisseria meningitidis. And basically that means that you cannot blanch the rash. That means that when you press on it, like when you press on your skin, it goes a little bit white because the blood is leaving the capillaries that are all supplying the skin, and then it usually comes back. If you do that on a rash, and the rash doesn't go away when you press on it, then that means that it's more likely to be this bacteria. Some use the glass test, where they push the glass against it because you can see through the glass, and if the rash is still there when you push it, then that definitely needs urgent checking with a doctor. Or if you're unwell, emergency department, just go straight away.
Someone is dying because I can't remember.
When you remember, you can page us.
Medical hypnosis can bring the brain to a class 2 theta state, increasing focus and memory retrieval.
So many people think like alternative therapies like hypnotherapy or acupuncture don't have much scientific evidence behind them, but there's actually a growing body of research that is using these techniques and using them really effectively, specifically for people where other therapies aren't available. Like, for example, acupuncture can be really useful in pregnant women who have access to limited medication, or hypnotherapy in people who've tried lots of different medications for anxiety and depression can provide clinically beneficial effects. But always make sure to go with a licensed therapist, because you don't want them to be making you do like a chicken dance or putting your subconscious at risk. So be careful who you go with, as there are many charlatans out there that will basically just try and make a quick buck from you and not give you anything in return, and sometimes they can make the problem worse than when it started. You don't want that.
Visualize the bus, the way it looked, the way it smelled, the people on it.
This is a waste of time.
Yeah, that's really interesting. I've actually seen a video before about how to hypnotize someone. Some of it is totally real. Some of it is kind of misdirection and distraction. Like, for example, there's one hand lock technique where basically they put you in a position where you can't unlock your hands anyway. You don't try and unlock them, and then basically they convince you that they've hypnotized you, and so you're not able to unlock them. But actually, if you tried to do it beforehand anyway, you probably wouldn't be able to do it. Like, you know, if you put your arms out in front of you and then you try and move your fingers apart, it actually does feel quite tough to do it anyway. But yeah, you know, imagine that there are people who can genuinely hypnotize them, and the technique is about, you know, making someone feel comfortable, making sure they're not in a state of heightened anxiety, speaking to them slowly with a low voice. You know, you are feeling very sleepy, relax, take yourself to a comfortable place. And then once you've hypnotized them, that's when you can get them to do whatever you want them to do. So, you know, like, you are feeling sleepy. Now you need to hit the subscribe button and press like, so everyone can see my videos, including you, as you want to see the next episode, Wilson's Heart. So check that out.
I can't get up. I can't move my leg.
Your legs are not your biggest problem. Your biggest problem is, I don't know what your biggest problem is.
Your biggest problem is, I don't know what your biggest problem is. I love House's confidence like that. The man's just been paralyzed, House. Have some sensitivity. Okay, I'm going to stop shouting at the screen now.
That's nice.
Leg paralysis, especially after a crash, you would think of spinal cord injury, but then why would it happen, you know, a little bit after and not during? And so that makes me think of other causes, you know, things like could be an infection in the spine, like transverse myelitis, could be something called Guillain-Barré, which is basically where your body starts attacking its own nerves from the bottom of the body up, and then eventually can affect the breathing muscles and can be quite dangerous. Or it could be vitamin deficiencies, like B12. And there are so many different nerve conditions, but usually they just don't come on that suddenly. So you could even get like hypokalemic periodic paralysis. But then, you know, that would show up on his blood tests if he had a low potassium. So we'll see. We'll see what it is. I'm curious.
Smell is the most powerful evocerator of memory. I'm going in, Rambo style.
House, do you think this is gonna work, or are you just stoned?
Evocerator. What an amazing word. House is so smart that he's created his own language now. I'm going to use that. Evocerator. It sounds like a machine, maybe. Like, what machine would it be? Maybe like a back massage machine. Call it the Evocerator. I think that would sell. $1 billion idea. There it goes. Give me credit if you use it. So smell and memory are really linked together because the area in your brain called the olfactory bulb that processes smells is actually quite close to your area that processes memory and emotion. So the three are very closely interconnected, and that area that does memory emotion is called the limbic system, which is a collection of lots of different structures that smell feeds into. Quite interesting.
$500 shoes, not on Princeton Crosstown.
Must be another reason why I'm here.
Yes. What do you have to tell me? I was talking to the passengers on the bus.
You were hallucinating. You're getting an MRI.
Oh, big spender! MRI first line! Wow, okay, so, I mean, this guy's got concussion, the things you'd be worried about, maybe brain bleed, especially after big trauma, skull fracture, all of those things. CT scan is the best first option, and it's fast, it's cheap. It does give you a dose of radiation, but it can even like show those problems a little bit better than an MRI scan, so you would go for that in the first instance. If you didn't find anything, then you could do the MRI, which might show some more kind of finer detail about the actual brain itself rather than the skull or any blood that might be surrounding it. But I mean, we're in the NHS. We're like the US healthcare system's poor cousin.
It's a longitudinal fracture of the temporal bone.
I bang my head.
This isn't just a boo-boo.
I'll rest once I figure out what's wrong with this guy.
Why? Why this guy? You want patients with weird, undiagnosed symptoms? You get 5 files like that on your desk every morning.
If you cracked your head open, would you be at work? I wouldn't be. This man is got some serious commitment. That makes me feel like there's something else to this case, something a bit more personal than just figuring out what's wrong with him. Like, the house always has a twist at the end. But if you do have a skull fracture, then you have to be really careful, because especially if it's at the base of the skull, there are lots of nerves coming out from that area. They can get affected, and sometimes you can get a sign that you got panda eyes. That is an actual symptom, or you are leaking clear fluid from your nose or even your ear canals. That's the fluid that surrounds the brain and the spinal cord. That means that the nice area that seals the brain has been compromised, and it can make you susceptible to things like infection. So again, any of those symptoms after any trauma, get checked out. I need to stop saying that. Just get checked out. No matter what happens, get checked out. Let's see what it says. So, thymoma, legionnaires, thyroid cancer, lymphoma, myelitis, myoclonic jerk, twitching the thumbs. Looks like he's trying to figure out what's going on. Oh, there's so many different systems involved. Maybe it would be something like poisoning, like heavy metal poisoning. This is where we find out the bus driver used to work at a nuclear power plant or something. I actually had a patient who did used to work in a nuclear power plant. He was such an interesting guy. He told me that it was back in the 70s and there weren't that many like health regulations and precautions back then. And you will never guess how this man used to boil his water. They would take the kettle and put it on the open nuclear reactor, I kid you not, and then drink the tea straight after. He lived to really old age. He had a few cancers, sadly, throughout his life, like 5 different types of cancers, none of them really that were fatal, and he basically ended up dying of natural causes in the end. But I thought that was really interesting. How the world has changed in the last 5 decades is honestly astounding. Poor House, he's got concussion, skull fracture. The man is still working hard. He needs like the Arabic mum treatment. He needs chicken soup, cup of tea, mint tea, and lemon and honey. He will be feeling better and diagnosing in no time. Come, House.
I'm the answer. Look.
I want.
Here.
Really interesting. So the patient's got the stooped posture and is walking with a shuffle, and that's because it could be a sign of Parkinson's, essentially where the area of your brain that controls movement is running a little bit slower than it should, and there's a lack of dopamine. So the treatment is basically tablets which replace the brain's dopamine. And I mean, it would be so unusual for it to present at such a young age. 1 in 20 cases only present before the age of 50, which this bus driver clearly is. Unless he's been using some skincare products that I need to take off him. You don't really recover from Parkinson's disease in the sense that it is a condition that is progressive. But there are conditions that can mimic the signs of Parkinson's disease. And if I was seeing this patient in my clinic, I would want to make sure that it wasn't one of them, which can cause Parkinsonism, which is only 3 letters difference, but makes the world of diagnostic change, because things that are as simple as anti-sickness tablets or antipsychotic medication can actually cause Parkinsonism. There are also some other more sinister causes like Parkinson's plus syndromes, but they usually make someone really, really unwell and have other signs like basically difficulty seeing vertically and also deranged blood pressure and heart rate, things like that. So that's Parkinson's for you.
Pop them up.
I got it. It's Parkinson's.
How's your ear?
You should sit down.
Interesting. So he's had a head injury. He's now vomiting. He's had loss of consciousness. At this point, obviously they've already scanned his head, but you would still be worried that there's something serious going on. You probably want to rescan his head with a CT, make sure there's not a small bleed that you've missed at this point, or that the skull fracture is getting worse, or that it's affecting the brain underneath it, or he's got some kind of infection. It would be really worrying if someone has these signs after a fall or a head injury, especially if they haven't been scanned already. Other things that would make you want to scan would be things like if they had a significant mechanism, like 70 mile an hour road traffic accident, someone were on blood thinners and hit their head, or if they fell from quite a high height. Things like if there's a wound which is larger than 3 centimeters, which basically indicates that there's a significant mechanism of injury, then it's quite interesting. The interesting part is, because the skull is basically a sphere, it's quite common that if you fracture one area, then you can get a fracture on the other side as well, like a reciprocal fracture. It's kind of like if you've got a circle, it's tough to break it just in one place. It usually has to break from both sides as well.
How did you eliminate Parkinson's?
Well, the test confirmed the abdominal pain was caused by liver failure.
Could be thyrotoxic periodic paralysis.
Well, thyrotoxic periodic paralysis, it's basically a problem with the gland inside your neck, which makes the hormones that provide your body its basal metabolic rate. So it allows them to create energy. When you've got too much of that hormone, your cells are working too hard, they're producing too much heat, and you essentially go into overdrive, feel quite anxious, can make your heart rate go fast, give you diarrhea, things like that. There is a rare complication of that, which also leads you to becoming paralyzed, which is more common in Asians, and between the age of 20 and 40. It is associated with low potassium and exertion. So, could be in this case, but to be honest, if you did your first set of blood tests, you would include thyroid function in that. And so you would know if that were abnormal by this point, where they've been trying to find out what's wrong with this chap for a while. So it's a bit unrealistic that they wouldn't recognize that by this point.
Run the Bagel Test.
How many more bagels do I have to eat for this to work?
High carbs plus exercise is the quickest way to confirm TPP.
Imagine you go to the doctor and you're feeling unwell, and the doctor says to their intern, "Hey, can you run the bagel test?" Imagine that. This test is not actually called the bagel test. That doesn't exist. You know how if a doctor actually creates a test or discovers a disease, then usually they name it after themselves. But if I do, I will name it a type of sandwich, a type of carbohydrate. Run the sub test. Basically, the bagel test, how it works in reality is that if someone is eating a lot of carbohydrates, that spikes their insulin levels up. The insulin then changes the potassium levels in their blood and shifts it into the cells. and then that person can develop paralysis if it's because of that low potassium. So that's what they're trying to do here. Let's see how it works out.
I told you not to lock the door.
Still wiping.
I love that. So I actually have a patient who basically the child was staying in the toilet for like an hour, and the mum couldn't realize what was going on. She was like, oh, you know, he's got diarrhea, he's got constipation, he can't get off the toilet, he keeps going 3 or 4 times a day. So I turned to the child, he was about 9 years old, and I asked him, why do you keep going to the bathroom? And basically he said, I don't know. And then I had a suspicion because the child didn't seem that engaged. He was kind of keeping his head down, looking, a little bit guilty, like children sometimes do when they've done something naughty. And I asked the mum, I said, does he take anything in the bathroom with him? And she says, yeah, the iPad. And I said, is he able to use the iPad outside? She says, yeah, but he's limited to, an hour and a half a day. And I was like, that is your problem. The boy is going there so he can play on the iPad. And I mentioned that, and the boy was like quietly keeping his head down. He was just nodding, said, guiltily accepting that was the reason. So cute.
The test worked. He collapsed.
You're half right.
He's wheezing his name. Yeah?
Can't wheeze without moving your chest muscles.
This isn't TPP.
That's really interesting. Wheeze, different cause of wheeze. It could be asthma, but that's unlikely in the context of lots of other things going on. His liver's not working very well. It's probably more likely could be multi-organ failure, wheeze related to fluid building up in the lungs because the heart's not working very well. I think that's probably more likely. So let's see why the heart's not working well. It still could be heavy metal poisoning if it's affecting the whole body. That's going to be my bet.
Right heart strain, he's still not oxygenating.
Must be a pulmonary embolism.
You would really get unwell if you have a big clot in the lungs. It can cause breathlessness, chest pain, particularly when you're breathing in, and usually you need a CT scan to check all the vessels that go into the lungs and make sure that none of them are blocked off. Treatment is usually with a clot busting drug if it's big, or just with blood thinning tablets if it's a little bit smaller and you don't catch it so early. I am not sure that this explains the full picture with him. I still feel like there's something else going on, but we'll see. I mean, it could also be that he's got something like endocarditis, which is throwing off clots into his lung, potentially, which is basically an infection inside the heart. Maybe could be related to having like dental procedures, or even if you've got an injury and bacteria manages to get through and you have sepsis infection, that can seed in the heart. Usually people who take drugs through the vein end up with this, especially if they're sharing needles or not basically using sterile needles properly. That can lead to endocarditis. I've treated a lot of patients with that. Can be really quite a tough condition to deal with. I even saw one patient who got it from a hair transplant in Turkey and then ended up coming back and needed antibiotics for 6 weeks and heart surgery because of that. Poor guy. Got more than what he bargained for, that's for sure.
Dental air drill pushed an air bubble into his gums. Dislodged while he's driving, caused a myoclonic jerk. That's what I must have seen. And it hit his spine, his liver, now his lung. Moved the bubble to the apex of his heart so you could suck it out.
Ooh, that's exceptionally rare, but they have actually described this in some case reports. It can happen. Usually the air bubble doesn't go through the gums, it actually goes through the jaw. It happens during jaw surgery, and the dental air drill can push that in there. Usually though, the bubble basically is formed during the operation, and it actually gets dislodged at the time of surgery. It wouldn't stay there for a while, although how does quite accurately say that it dislodged the bubble rather than, creating the bubble now. So maybe it's that the bubble was stuck in his jaw and now he had the crash and then that dislodged it, and it's slowly going around. But, it's not like the bubble would just sit around, with his arms crossed, like drinking a cup of tea, like just waiting for a week until it goes to visit these tourist destinations, the liver, now the heart. It's like the bubble's Euro trip right now, which is kind of not that realistic. But I like their attention to detail. Still, it's still good. Still good.
Stab his heart.
Stats at 75.
Yes, he's suffocating.
If you're wrong.
Shut up and make a decision.
VO2 sats. There was an air bubble. He's okay.
Damn. I like that. Like, just pow, straight in the chest. The chances that you hit the right spot by just doing that, very small. You really need some kind of scanner. People have like portable probes right now that can work even with your phone, that you can literally just quickly do a fast scan and then, put the needle and aspirate. You would need to be highly specialized to even consider doing this procedure, because the heart is not like a still structure either. It's like constantly moving. So the chances that you would get it just by push and pull is very small. But hey, it's risky. It's good television. I like it. I'm into it. Let's carry on.
Hey.
Go away.
It's not over. I saved the wrong person.
Ooh, well, we've still got 15 minutes left of the episode, so here comes the twist. Who could it be? I mean, the next episode is called Wilson's Heart. Could it be Wilson, who is the one that's being unwell? But, I mean, that doesn't make sense. Wilson looks like he's okay. We'll see. I don't know. I feel like it's related to Wilson. We've seen him a lot more than usual in this.
You know who I am. What's my necklace made of?
Resin.
Who am I?
I don't know.
Wait, Amber, that's Wilson's girlfriend. Amber, that's it. It must be her. Oh, that means House was on the bus with Amber. Naughty. Well, I wonder what was wrong with her. What was her symptom? Let's watch her.
Amber.
Oh, naughty Dr. House. That's bad. Okay, so it's interesting because before in the episode, basically House had said to Wilson that he remembers Amber was there, and then there was this thing about him fantasizing about her, and now he was on the bus with her. So I'm interested to see where this storyline is gonna go. Yeah, we'll see. I don't know why they were together, but that's gonna be an answer for hopefully the next episode.
Stay with me. Just stay with me.
Oh man, that metal pole. Ooh, so that's an interesting injury. You can use a tourniquet basically to stop the blood from coming out, which is fine, but you can't keep it on for too long. You need to get someone to an OR as soon as possible because you don't know where that metal rod is. It could be going through an artery, and that could compromise the whole leg itself. And the last thing you want is to lose it, obviously, after an accident. As we know in 3 stories, what happened to House, so you can't be too careful. So watch that reaction if you haven't seen it. It's very good.
He's coming out of it.
Strong pulse.
You idiot. Your heart stopped.
It was Amber.
Oh, what a plot twist! I guess we guessed it just earlier, but it'll be very, very interesting to see what happens in the next episode. I haven't seen these two before, What did you think? I thought it all tied together really nicely. I like the extra twist at the end. I love how House cures someone's problem accidentally, saves their life, and it's like, oh damn, I saved the wrong person. Oh, that's terrible. What a bad day in the clinic. You know, you can say what you want about House's patient skills or communication, but when it comes to diagnosis, medical accuracy, House has to be the medical drama to watch. I'd probably say 8 for medical accuracy. There were some bits that weren't quite believable, and I would say another 8.5 for entertainment value. What did you think? What would you rate it? Let me know in the comments below. Did you enjoy it? Do you want to see more? Do you have any other episode requests? And if you haven't seen 3 stories, you can check it out here, or if you're on mobile, then it will come up in this corner here. Much love for all the support you've been giving me so far. It seems like you guys are really enjoying these reaction videos, especially with House, and I'm enjoying reacting to them as well because I learn a lot. Check them out. Take care, and I'll see you in the next one. Peace.